Now, what's the lifestyle that we're talking about? First of all, our diet. We talk about a high protein, low carb rate diet, 70% protein, 30% vegetables. It's a little bit of a misnomer. It's not really a high protein, low carbohydrate diet. You're eating a tiny amount of food initially after these surgeries. And because of that, a high proportion of what you eat needs to be protein. Again, you don't have to eat T-bone steak to get protein. There's a variety of sources of protein, both vegetable and other animal sources, so again, it isn't that difficult. We preach using a healthy, fresh diet to help avoid some of the toxins in our environment. You got to get rid of this toxic environment as continuing to poison us. So again, lots of ways to solve this problem. The second arm of it is drinking lots of fluids. We're a dehydrated society to begin with, and when you're losing rapid weight as well, you need lots more fluids. We recommend a minimum of 64 ounces of water a day. No coffee, no sodas, no alcohol. Again, these are part of some of the toxins in our environment. Daily vitamins and minerals. Again, many of us are deficient in those as well already before we have the surgery. So again, starting to take multivitamins and so forth before it can be helpful. During rapid weight loss, you need extra vitamins, particularly B vitamins. It's important to follow them. We keep it simple. They don't have to be expensive. Just name brand vitamins that you can buy at Costco's or Smith's or any of the centers around here. And then exercise. It's got to be a combination of diet and exercise for it to be effective. The most effective treatment is a combination of both. The most successful patients there incorporate good lifestyle with good dietary habits to help them not only lose optimal weight, but keep that weight off long term.